policymaking chain. And we wanted to round out the discussion by having a conversation with federations that are doing it and doing it well. As you all know, the Health and Fitness Association advocates on the ground in Washington, D.C. and across all 50 states in the United States, but we also partner strongly with our federation leaders around the globe to provide assets, tools, infrastructure, but also make sure that the industry is speaking with one unified voice, so that what we learned during the COVID-19 pandemic is that, when we have a fractured message, we're not able to really make the change that we need to make. So I think the more we can be working together across the industry and across federations to all be speaking from the same sheet, to be talking to governments and producing the policies that we are all collectively urging towards together, the more we'll be able to really make an impact on the physical inactivity crisis. And position, frankly, most importantly, position the health and fitness industry as the key driver and key catalyst to make that change. So I'm very excited to be joined today by Huw Edwards and Karl Dunne, and I'm going to turn it over to you all to both introduce yourselves and the organizations that you represent.
My name is Karl Dunne. I'm the CEO of Ireland Active. So we are the Leisure Health and Fitness Association in Ireland. We have about 500 members who are facilities, swimming pools, and they come across from private sector and public sector.
Afternoon, my name's Huw Edwards. I'm Chief Executive of ukactiv, the industry body for fitness, leisure, physical activity in the UK. Around 3,500 members covering public, private, independent suppliers and the wider activity community as well in the UK.
So Huw, I know that ukactiv, you besides lobbying, you engage a lot across policy making field to really promote physical activity and promote the industry. Can you talk a little bit outside of the direct engagement with some of the tools and resources that you're using, the strategies that you're using to really drive change and position the industry well?
Yeah, so we have a overarching strategy for the sector in the UK is called Vision 2030. We got that just out before Saudis did as well, which is hence the sort of slightly different perspective. But our North Star, is around achieving 20% of adult population of UK being using our members' facilities by 2030. But we started that strategy a couple of years ago. We were around sort of 14.5%. We're now at 70%. The numbers that we produced this year are showing the size and scale of the public and private growth. Has been really powerful. Over 600 million visits in the UK last year. The basis of our organisation really, complementing a lot of what just happened in the last panel, is based around sector intelligence research, having a really robust understanding of the sector's growth, but also consumer behaviour as well. A huge amount on the risk and standards. There's a huge amount that our members have to navigate in terms of health and safety, reputational risks, societal changes, and we support them in navigating what is an ever complex world. We do a huge amount working with government and agencies and other sectors in almost future-proofing the sector. So looking at areas of digital, looking at areas of children and young people, the next generation of our membership, looking at the areas of health integration, we'll talk about in a bit more detail, and looking at sort of the wider infrastructure requirements of our sector. And then obviously campaigns, lobbying, major campaign we did last week at Speak2See, we saying like National Fitness Day, huge mobilisation across our members across the country, 45, 50 MPs, parliamentarians involved in the day, the biggest number we've ever had, but also ministerial and the Prime Minister's endorsement on the day as well, which was great. And then those areas of policy that we work with our members and trying to drive improvements to the landscape which will allow them to grow and develop. So the spine of our organisation is those four areas really.
Yeah. So driving from 14% towards 20, that's quite a lofty goal, right? That's 6% increase. You're already halfway there. How are you working from the, federation to consumer perspective to make sure that the consumers understand the benefits that are there and then actually seeing that consumer adoption?
Yeah, and there's a huge amount of work we're doing around our consumer polling right now. So we're working with our partner Samantha in the UK to really understand where the motivations are, where certain obstacles are as well. Obstacles remain, pretty much the issues around locality and price still. But we know there's a highly competitive price range for all our membership. Clive in the room with Pure Gym, the biggest player in the UK market, and the price point there, which is highly competitive. And so there is obviously those two areas of importance, but also widening the narrative around the value of these facilities, around the physical, mental and social well-being of communities. I think, having worked previously in government about 15 years ago, but also worked in sport as well for British tennis, the conversation in government around policy has been really controlled around major events and traditional sport. And when I was at British tennis, I was reinforced there in some respect. So I'm coach at home, gamekeeper in some respect now, whereas you're trying to widen the conversation and actually see where sport has a key role to play, especially in the enrichment of people's lives. But the big drivers of activity and the visible big drivers of activity in the UK are going to be driven by our members' facilities and services, whether it be digital or at the person and the facility as well. And it's that narrative that we're taking into the conversations with government and with the players as well.
Yeah. Karl, what about you? I know, similar to us in the United States, you've been doing a lot of work to make fitness more accessible in Ireland by driving at the reduction of cost. We work with the government. Can you talk a little bit about the initiatives that you guys are advancing?
Yeah, sure. We started this journey 10 years ago, and it's not rocket science. It was how do we get a tax credit for people who are using our members' gyms? And we came up against a lot of challenges with government. The big challenge we had was that the government said, well, if we give a tax credit, gyms will just put their prices up. So there's no benefit. So we went back and we looked at that, and we came up with a solution for government to ensure that we could get the tax credit in, but it didn't actually affect the gyms by putting their prices up. So we have a system in Ireland, I'd say it's similar pretty much all over the world, where you get rebates on medical expenses, dental expenses, physios. So we put a structure in place for the government that people could actually claim tax back on their gym membership. And the government liked that, and last year we proposed it to them. We then did an independent survey as well, where we said, look, independents went out there, and it was 28% of people who aren't currently members of gyms would be encouraged to actually take up physical activity in the gyms if there was a tax benefit. Brought this back into government, presented it with all the data, and our last budget, which was around this time last year, the Minister for Finance in his budget speech, we didn't get it last year, first of all. He did actually mention in his budget speech that he was going to work with us and other industries to actually implement it. We then subsequently had an election last November, and all the political parties in Ireland had it in their manifestos.
Wow.
Yeah. On back of that then, when the government did come into power, and it's a coalition, their programme for government has it in their programme for government that they will actually implement a tax credit. So we got a budget announcement in the next 2 weeks, and we're hoping that's going to be in that. But again, it's been a long road. It wasn't the da moment, and there was a lot of challenges, but what we kept going back to the table with, when we found what the challenge was, or the break was, we'd go back and try and fix it and give them a solution. So that tax credit hopefully is coming in within the next 12 months.
Oh, that's great. And I just, a question that I have is do you all activate the consumer at all in helping engage with Parliament and helping engage with the policymakers themselves to show the value and to show, frankly speaking, not what the adoption would be, but what the support is behind the movement?
Yeah, so as part of our strategy, we got our member facilities to actually activate their members. So we had a big groundswell. We're quite militant on it. We went out to all our members with pre-registered or pre-typed letters and a list of all the local politicians that they were to send them to with their email addresses. So they got pretty much bombarded from all over the country with this campaign.
And that's incredible. That's incredible. We in the United States, we have our grassroots network that we use, and I consistently tell our operators that you all have a grassroots army below you that should be speaking to policymakers and utilizing the tools we have, those click campaigns, to really drive change. So federations, to both of you, federations are bridge builders between government and the public. What is the secret to maintaining credibility and balancing the work that we do with the different interests that you have, not only of your members, but of the general public as well?
Yeah, a big part of that is trust with government. Government have to actually be able to trust you as an organisation or an association to actually implement certain policies that they're looking for. So we're like an activator for them. And a little bit of context on that, we do a number of different things on behalf of the Irish government. So one of them is In Ireland, if you work with children or vulnerable adults, you have to be vetted. I think it's the same in the UK and all over the world. We are the administrators for that on behalf of the police force for Ireland. We then also work with Sport Ireland on a number of initiatives. We also work with the Department of Health on their initiative in relation to a register for, and it's just been established this year. We're now going to operate the register for them, for fitness professionals, and medical professionals, for people who want to work with physical activity for people with chronic conditions. Wow. So we're moving into that health space, and we're now actually relevant to the government, and we're actually helping them implement their policies.
Oh, that's great.
Yeah, three things for me on that, Michael. I think it would be, and echoing what Carlos just said, is around confidence in the facilities. We've started rolling out this year as part of our membership something called the Active Standard, which is effectively a guideline for our members, which provides ensuring that they are 80% of it is operating within the law. So all the technical associations with operating the facility, they are meeting those standards. And the other 20% is stretch, looking at some of the wider policies around cybersecurity, looking at women and girls, in terms of safer spaces, etc. And so this is being rolled out across our membership. We already have, I would say, probably 1,500 of the sites already through that, and continuing pace on that. But that provides confidence back to the sector. It's confidence for local authorities and wider operatives who know that is now being built into some of the tenders that are going through. Eventually, which are not there yet, will become a B2C piece and a consumer piece, but we're not there yet in terms of its journey. The bit with government at central and devolved is around education, fully understanding the programs, the services, and the impacts of our members' work, and that comes through a lot through the social value analysis that we do, the impacts, especially on the preventive agenda, mental health major report we just produced last week, looking at 72% of people who have mental health conditions find exercise hugely valuable to stay in work. It's a huge area of importance right now in the UK. And it's just making sure they really understand the breadth of different services that these facilities are providing through their business as usual, but through some interventions programs as well for particular cohorts.
Yeah. I always find it so interesting in my conversations with lawmakers how little they actually know and understand about the industry and what the industry does and frankly the business engine behind it. In your conversations with lawmakers, with government, how do you interpret and understand just the credibility piece, the reputation piece of the industry in your respective regions?
Yeah, happy to take that one first, Carl. It's there's two great examples of that live right now in our conversations with the UK government. The first is around a government announcement just in July that they were going to invest £400 million into the community facilities across the UK. The frenzied nature of the lobbying that's gone into that between ourselves and traditional sport is a bit of a bellwether for where this money goes, because if it's invested reflecting where public demand for the services is, then it's absolutely it cannot go anywhere else apart from gym, sports and leisure sectors. And it also needs to be complemented by an understanding of what the private sector growth is in the UK as well. This will probably be much more public sector focused, especially around swimming pools. So there's a huge conversation here, to your point, around making sure they fully understand not just reverting to the policy orthodoxy of the last 20, 30 years, but they recognize where demand in communities is for services and what needs to be provided in order to satisfy that demand. The second is around workplace health. The UK has got a record levels of long-term sick and economic inactivity. The conversation that we're having with the government and with members next week is looking at government's plans or keep the Britain working, which is the sort of the phraseology they're going to be using, but primarily looking at young people in their 20s who are economically inactive because of mental health, and people in their 50s are economically inactive because of musculoskeletal issues. Both are opportunities where our members can drive huge return for the government in this parliament if mobilising us in the right way.
I believe I remember a few months back the UK releasing a study about getting the UK back to work, and we were actually surprised. I remember connecting with Rokas about this, about the lack of physical activity being mentioned as a way to do that. So it's nice to hear that you're having those conversations and many of the labs of breakthroughs.
Absolutely. I mean, the first 12 months of it'd be fair to say the first 12 months of the new Labour government's been quite challenging in terms of feeling that they've returned to some sort of policy orthodoxy of the past. It's only the last real 6 to 8 weeks that we're beginning to see some light in terms of some of the conversations around our centre's role to play. It's a huge amount to do. And we're nowhere near where we want to be with them yet, but we feel there's some slope moving in the right direction.
Yeah, Karl, how about you?
Yeah, again, it goes back to that trust piece. And if I take it back to when lockdown happened on COVID, we really came into our own then with government. We were able to actually develop an operating framework for gyms and swimming pools to reopen. And on the swimming pools got reopened before pretty much nearly everything. And that was from data we had gotten in conjunction with Swim Ireland and Irish Water Safety. And also going into government and say, look, children need to get back swimming lessons. So we got the swimming pools open. And then after that, we got the gyms open because we had a national framework of operating that we were able to give out to all our members. And I remember sitting on a call with the Minister for Sport, and I think it was like 25 different sports on it, and they were all indoors. And they were going absolutely ballistic because they couldn't go in and play badminton, the martial arts couldn't play basketball. Well, I'm sitting there kind of going, we're open, I'm okay. So it's that trust piece with the government and actually being an activator for them and helping them solve their policy issues as well.
Yeah. Let's talk a little bit about building those champions. Do you all in your work, have you identified those key players, those key members of parliament or members of government that you can rely on, that you can go to? And then when you do have those conversations and you are successful, frankly, how do you make it not so much a one and done type win, but something that you can continue to enhance and flourish that relationship so that you can continue being that catalyst between government and people?
One of the big things we do, and again, we figured this out pretty early on. Governments come and go, ministers come and go, politicians come and go, but the civil servants are pretty static. So we, as a strategy...
Unless you're in the United States.
So what we targeted those guys, and we found champions within the different departments to help us, and we went in and we lobbied them. I think everybody in the room will know the minister is the last person to actually make a decision on anything. The civil service made the decision pretty quick, or pretty early on. So it's either a yay or a nay from them, and if it's a nay, the minister isn't going to bring it in, no matter how much lobbying you do to him, unless it's a personal pet project. But it's the civil servants, and that's our strategy all the time. And we have built up a large network of champions within different departments, not just sport, it's health, education, employment and finance as well, to help us navigate and to get what our members are looking for.
Yeah, we completely concur with that. I think those senior civil servant relationships, permanent sector relationships, the people who head up the government departments, is the level of consistency across what is an extremely volatile political environment. In the time I've been in the role, I think there's been, at ukactiv, there's been 10 different secretaries of state who are contributed to sport, sponsored parliament in sort of 8 years. I've also had 5 prime ministers in the last, in a period of time. So the election in 2024 in the UK had the biggest switch in parliamentarians I think in history. So it means a lot of the investment that you've made in the previous 5 years, you're back to there, and you're building up their advocacy with parliamentarians, with ministers, with their new political advisory teams as well. So it takes a bit of time there. So the consistency is really important when it comes to civil servants. The one observation in the UK government right now is the profile is a bit younger. There is feels in the conversations I had, probably 70, 80 MP meetings in the sort of last 12 months, would be an instinctive understanding more of our sector than probably their predecessors, which I think is quite positive in terms of the conversations they're having in their constituency, but also making parliament around certain areas of policy development in the next 3 years.
How do you keep your members motivated? A lot the challenge that you see is when in the absence of a crisis, right? Continuing to have the engagement of your members and the work that's being done. we all, you love to have the trust that it's just getting done, but knowing that to do the work that we do, the engagement of our members is really valuable. How do you continue to engage your members and make sure that they understand the purpose and the benefit of staying engaged in the advocacy process?
Yeah, I suppose if I take that a step back, part of the engagement piece is actually, how is this going to benefit your business? And our kind of North Star is, anything we do, does this benefit our members? And one of the key, it's probably one of the biggest member benefits we have now in Ireland Active is we have an education piece, and it's called a SkillNet. So we get funding from the government to upskill fitness professionals and aquatic professionals. So if somebody wants to become, I'm using this example, from a fitness instructor to a PT, and it's €1,000, we're able to actually take 25% and put that towards their training. That has built up the advocacy piece on our members because they actually see value from what we're doing. And now we've steered it towards the health piece. So we developed, again with funding from the Irish government, a course for fitness professionals to work with cancer patients. We're about to next year develop one for people to work with pre and post cardiac. And then the next piece on that is for a course for fitness professionals to work with people who are using GLP-1s.
Yeah, that's great.
Yeah, I think it'd be fair to say, in the first 12 months, especially this new government, a lot of our members will be very frustrated in terms of, understandably so, in terms of where the current government has to date in positioning our sector and the viewpoint of that. And that, it's very important that we continue to have that level of transparency. The ambition from myself and my team would be make sure we're getting our senior leadership of our members in the room with parliamentarians, with MPs, with ministers, especially with the Secretary of State, then be having those conversations. What we are doing in terms of what we have evolved, especially in the last sort of 2 years, is really strengthen the governance structure around how our members are actively involved in some of the framing of our policy work. So next week, for example, in our next cycle of council meetings that we have with our 5 different parts of our membership profile, it's building out sessions next week, workshop sessions to inform that 26-27 business plan for UK Active, and ensuring that their viewpoints on where those policy priorities should be, they're fully built into that process.
Yeah. So as we come to the end here, I want to just wrap up with a few takeaways for those in the room who may be part of a federation or have a federation, but maybe aren't engaging in the advocacy process so much. So what are some, foundational thoughts that you have around establishing a strong advocacy portfolio and engaging on behalf of the industry? And if you're somebody that, really is starting from scratch, what would you each say is square one?
I suppose the big one for me would be make yourself relevant, make your association relevant, and find out what policies the government are trying to implement and see how you can actually align to those. And then you become relevant, and then you start to build from there.
Yeah, absolutely. It's around going into the room and going into the conversation with policymakers that you are a solution to some of their problems. The UK right now, the 2 biggest things that will determine the success of the current government will be around securing economic growth and pressure of the NHS. Our members are driving economic growth, and I'll tell you, pressure of the NHS, and it's about then, working with them. The encouragement would be then to work with the government to show that you are a real solution and can deliver tangible benefits, which will be beneficial for them as well as beneficial for the government as well.
Yeah. So in closing, we've been talking each a lot about national advocacy. I think the importance is for us to really come full circle and understand what the impact is and what the strength could be of this industry if we're speaking globally. And if we're all speaking together towards similarities, even though, the way our governments operate are all different, the way that our organizations operate are sometimes different. What's a parting thought from each of you about the importance of us speaking together collectively and really trying to drive towards goals as a collective global industry?
Yeah, I think, on the national level, globally, I think we're all aligned, but it's really important that we have actually everybody. There's this phrase in Ireland going, you need to get everybody on the bus, but you actually need the bus facing in the right direction as well. So it's really important that from a national level and then from a world level, that we are actually singing off the same hymn sheet as well, so that we're delivering that message, and it's the same message and it's consistent.
We typically engage is find the hook of where in our situation the committee focuses. So for instance, in our bill for tax reduction, same thing. We see it as a health bill. We see it as a public health bill. You build your champions through the committees that represent health, because they will have an interest to support, but ultimately it's a tax bill. So you need to work with the committee, in our case, Ways and Means or Finance, it's in the Senate, to really hit the niche of the policy change. But ultimately it's about building the movement. And so I don't think it's necessarily about limiting who you talk to, but talking to everyone in a way that is going to resonate based on their seat in their jurisdiction.
Yeah. Just to add to that question and conversation then, so within the EU, to what degree are the tax decisions made from Brussels? To what degree are they delegated to national government? So we're seeing in Denmark right now a change to the VAT policy on education effectively, but that's the read across into part of our business that is class-based, PT-based, when the VAT rate is going to increase based on the directive from the EU. In fact, the Danish government are doing everything they can to mitigate that, to be fair, and to find tax credit solutions like you've done in Ireland, that because they recognise that price is a barrier to participation. So what degree are these decisions made out of Brussels, and to what degree do the federations need to negotiate to Brussels as well as into their own governments?
Yeah, every government, every country has a bandwidth that they can set certain tax bands. I think in Ireland we can set 4 tax bands, 23%, 13.5%, 9%, and then you 5%. 3 years ago, we actually, and the reason we found this out was we were lobbying for zero VAT on gym memberships. Minister came back and said, no, we can't do that. There's only 4 or 5 brands of tax brackets that we have, and that's dictated by Brussels.
We'll take 5.
5. So within each country, they have maneuverability to set the tax bands, but they can't have 10 tax bands. I think it's 4 or 5, and that's it. But on a European scale, yes, the European associations need to be going to Brussels and actually lobbying the European Parliament on that.
And perhaps that's a way to, show the coalition, show the strength of the industry throughout Europe. We produced our price elasticity study that could be a very strong tool in that conversation, because I surveyed, correct me if I'm wrong, 10 nations around the globe, and it showed the positive benefits of investing in reducing VAT or reducing a tax rate, and what that would do to, spark activity. But by the same token, you can read that study and show and make the case that by adding, you're actually going to hurt the possibility or hurt the current participation rates from square one.
Yeah. Very interesting conversation. As we discussed, how we can align our messaging and collaboration and around research, definitely want to make sure as well that it's applicable outside the Anglo-Saxon world, right? And I know we have some other federations, including the Turkish one here. So I'm just curious, Mahbub, to hear how this conversation kind of resonates with you and the kind of advocacy landscape that you work in. What similarities are there, and what kind of sensitivities or other factors do we need to account for when we if we really want to collect the truly global perspective of the industry?
Yeah. Thank you. And thanks for your presentation and speech. I really make some notes. They're very useful. Let me introduce myself. This is Mahmut from Turkey Bodybuilding and Fitness Federation. I'm the vice president, and we are leading the industry in Turkey. 6,000 fitness gym and 28,000 trainers. They are working with us. We are providing certification for the work from the sports ministry. And we need some regulations, some laws, and we need to share our experiences. Also, this is our first year in the Health and Fitness Congress here. That's why we are so exciting to work together and we can share our experiences together. And I have a question, because I'm curious, about some special courses from Europe, from USA, you know, a lot of popular courses, certifications. They say that, okay, we are the best, our certification is the top, and they also fight each other, they argue each other, and of course we are not in this section. We are representing government, but I'm curious that how do you manage that? Do you have any system, regulations to manage all courses or certifications? Is there any problem in your industry, in your countries? We have, but we manage now. We have some regulations and everybody respect each other. Of course, firstly, they apply our federation. We provide certification by government. Then they can establish their gym. And then they, of course, join other courses for, you know, personal development. And they learn how to manage the facilities. What are you guys doing in UK, in Ireland? I'm just curious, and thanks.
Yeah, one of our departments is we operate the Register for Exercise and Fitness Professionals, and that has two aspects to it. We have an auditing team that go in and audit the training providers, so the people who are training the fitness instructors, PKs, and then we have the outfacing part of the register, where when you get qualified, you're on a register, and that register you can travel the world with that. So, for example, we have a lot of Irish people going to Australia at the moment, and the Australian government recognises the Irish qualification. But again, we manage that, and it's not easy, because you would have a lot of private providers, training providers coming in, wanting to set up. You can be a PT over the weekend online. You know, we don't actually allow those courses. You have to do a physical course and an in-person course. So we manage that ourselves, and again, it's recognised by the Irish government, but it's then aligned to the European standard, and then aligned to the ICREP standard as well. So there's a standard there for that.
And in the UK, there's a separate organisation to ukactiv called SIMSA, which is government created, which looks after the overall workforce requirements in the UK.
Can I add to that? Because I'm on the board at SIMSA, looking out for the level of education is provided, and it is a struggle. And when you mentioned trust, I think that is a big conversation we all need to talk about. A lot of the education has been based on a lot of outdated data, outdated information. We've got a lot of courses that sell on the premise of we're now backed by research. Well, that means that you are happy to go ahead without research if you're ahead of research. So I think that is an area that could be expanded on. It's very, very difficult. But in the UK, we have our basic level 3, level 4. We still have the same issue that there are providers out there that do courses that are called level 3, and people are still buying them thinking they have a certification, and it's actually a CPD course. So there are areas that are difficult that I think can be improved on. And
I think it's frankly, it's a global challenge. In the United States, we have many certifying bodies as well that range from, the overnight online to the more evidence-based instruction and training. A lot of the work that we've been doing is trying to position the industry as a resource for preventive health. And ultimately, the United States healthcare system is a much different operation, right? And it's very focused on treatment. And in order to do that, we have the trust issue that we need to build from day one to say, if we are going to do that, what are the certifications that are in place? Who are the general public being referred to into a network that they can be trusted by the payer community, the insurance community, but ultimately the medical community and the government?
100% agree. I mean, I'm doing a similar thing with IDEA. making sure that those standards are raised, with NASM and everything like that. So 100% agree. It's a worldwide challenge.
Any other thoughts, questions? Well, thank you all for coming. Really appreciate your time. And then we really look forward to continuing and growing the conversation. If you are, in communication with other federation leaders, I think it's important for all of us to be sharing the importance of coming together when we are in person, but also HFA will be leading some virtual calls as well to continue this discussion and continue to grow our participation of our global federation leaders together so that we can continue to share best practices, share learnings, and continue to grow our overall global impact and voice.